Morning, everyone, and thanks for coming along to hear about the work that we've been doing to try and better understand what home care workers think about online delivery of training. So I'm Briony Dow, but I'd like to acknowledge some of my colleagues that have been working on this with me. So particularly Professor Colleen Doyle, Erica Wise, Esther Tan, and Anita Go. So you'll see there's a big team of authors there, but these are the people who've been mainly working on this sub-study. So it is a sub-study of the Promoting Independence Through Quality Dementia at Home, the PITCH project, which is an NHMRC funded project in which we have co-designed a specialist training program for frontline home care workers. And we were funded to do this in response to a number of reports that identified the need for specialist dementia care training for home care workers, including the clinical practice guidelines and principles of care for people with dementia put out by the Cognitive Decline Partnership Centre. But it's also been identified by the Royal Commission into Aged Care Quality and Safety and our own lit reviewing in this area. So PITCH has been developed as a specialist training program for frontline home care workers. We co-designed this back in 2018. And we started with a randomised controlled trial to test whether or not it improved outcomes for home care workers, family carers, and people living with dementia. But along came the pandemic in 2020, so we needed to convert the PITCH training program to an online program so that we could continue with the randomised controlled trial and enable our home care workers to keep receiving the training. So what was a 2 by 3.5 hour training program became 3 by 2 hours online. To date, we've trained 150 home care workers from 7 different service providers in 3 Australian states, and 95 of them have had face-to-face and 57 have had online. So as we all know, training is increasingly moving online, and this was happening before the pandemic, but the pandemic has massively accelerated this. And there are a variety of ways in which online training is delivered. It might be real time, which is the PITCH approach, so that the group are engaging with each other and the presenter in real time and can engage with role plays, quizzes, interactive activities. Or it might be something that you can do in your own time, or it might be a MOOC or a webinar which are moderated so that there's somebody online that you can ask questions of. Despite this, there's very little evidence to date about online learning in aged care, although there is some evidence of benefit to health professionals, and those numbers there refer to the references, which I'll give you at the end. But no evidence about how home care workers prefer to learn using online platforms. So we were interested, we had this opportunity with having this group of home care workers who had experienced online and face-to-face training. We're interested in finding out more about their preferences and opinions about online training, and to enable us to tailor any future PITCH training delivery to what they prefer and what they need. So basically our question was, what do home care workers think of online training? So we ran 3 one-hour focus groups via Zoom, which were facilitated by 2 researchers and each had 2 to 3 participants. So we invited all of the home care workers who'd been trained at that point in time, which was earlier this year, and that was 55 people. And we also invited the home care workers who'd been part of our co-design process where we designed the training program back in 2018. And they were offered a $60 voucher as reimbursement. And the focus group discussions centred on the challenges, the benefits, the platforms and logistics of online training. And they were recorded, professionally transcribed. And then myself and Colleen Doyle conducted a content analysis of the transcripts. So only 8 people attended the focus groups out of the 55 that we invited. And as you can see, only one of them actually had attended the online PITCH training. Most of them had attended face-to-face, except for the two who had attended the co-design workshops and then hadn't attended pitch training. There were 6 women and 2 men, and most of them had quite a bit of experience working in the aged care sector. So from 5 years to 16 years. And we had 6 home care workers and 2 who were more in team leader or coordinator roles. As I said, only 1 had had online pitch training, but they'd all had some experience of online training. So they'd all had webinars or short courses provided by their employers to do their mandatory training. A lot of them had attended a MOOC, and in particular, the Wicking Dementia Centre MOOCs had been well attended by this group and well liked. They had online training where they'd had a quiz at the end and they'd had scenario-based learning. So they had quite a lot of experience in online training. So what did we find? We asked them, well, what words come to mind when online training is mentioned? And as you can see, they thought it was challenging, quite hard, difficult. They talked about their devices, but they also talked about how it was flexible, convenient, accessible, and so on. So what did they like? They really liked having real life examples in their online training. They liked watching videos and role plays. They liked having someone they could ask questions of. And they were happy whether that was at the time or whether there was a set time for questions, but they liked to be able to follow up on things they didn't understand. They liked being able to take in the material at their own pace. And this was particularly the case for people where English was not their first language. They liked having real-time connection with others. So they liked the real-time approach to online learning. They also liked learning from others, their peers' experience. They liked to be interactive as much as possible. They liked being able to look things up online during the training. They also, though, liked the flexibility to do the training when it suited them and to break it up. They found it to be accessible, efficient, and they were particularly interested in material that was well organised. So there was really onus on the person presenting the online training to make sure they were really well organised in their material. And they also noted that it could be less expensive to them to attend. So some of the quotes that illustrate these points, someone said, yes, I'll catch up on all the modules I need to do in the car because it's just so much easier and very convenient. So this is someone talking about the mandatory training modules they have and that they can just do them whenever it suits them. Someone saying, I don't have a bad experience with online trainings because I've got the right equipment and the way it's set up. You can have it on audio, the speaker will speak what you see, and then there are quizzes, so it's very interactive. And finally, what I liked about videos is you can stop them and start them and replay them and read information at your speed. And if there's any words you're not sure of, you can look it up. So you can see there's kind of I guess, 2 views. One is it's good to be able to do it at your own pace. And the other is that it's good to have it as interactive as possible and in real time. So I think what we need is a combination of both. What they didn't like, a lot of it was about the technology, using a phone that was too small and technological glitches, but also isolation, not mixing with others. They didn't like it if you didn't have clear instructions or the technology was hard to follow. They didn't like not being able to see other people's faces or have a laugh. They didn't like the not meeting people and chatting in the breaks, the lack of refreshments. They didn't like it if there was no technical support backup. They didn't like not being able to share things and learn from each other. And also the distractions that you get online where you've got emails coming in or you can see that the dishes need doing. It also can be pretty boring learning on your own. And as I said, home care work can be isolating and you miss having the opportunity to catch up with your peers. So some illustrative quotes. I think if I had a computer, I would have been able to go through everything a lot easier through the modules and that. But because I had such a small screen, I sort of just decided to give up before I really got started. I'm not what you would call tech savvy. We're carers, we're doing more nursing type work rather than We've got enough to learn on these things, but that's my sort of challenges, the technology side. And finally, we've become so isolated. Another person mentioned their name, would understand that too, because you're working by yourself. We've got numbers of other carers, and that's fair enough, but we're on our own. Then not to have some interaction through a meeting, we haven't had that for about 3 months now. So clearly issues around feeling isolated and online training not helping. So what we learned for our pitch project was that we did actually ask them what they preferred, and they all said they preferred face-to-face training, but they all felt that there was a place for online training. And if online, the correct equipment was essential and training in how to use it. They did value being paid to learn from home. Video content with case studies were a highlight. They liked live or scheduled facilitation or moderation. And what we learnt was we need to make recordings and make the printed materials available for before and after the training for their own paced learning, as well as the real-time interactive component. So there are lots of limitations. We had very low numbers, and that probably reflects a more negative view of online. I think they were voting with their feet. They didn't even being offered $60 an hour, which is for 1 hour, which is quite a lot of money for someone who's more likely to earn more like $25 an hour. We didn't get many people taking this opportunity. So maybe that really is indicative of what they really think of online learning. We also focused on a range of types of online, and that really means that, we were getting different views about different types of online learning. And clearly they're not representative of all home care workers. So future research, we think, should focus on drilling down more into the types of online more carefully, looking at the cultural and linguistic backgrounds of the home care workers, and what their specific learning needs might be, and also understanding better the education level of the home care worker and what that might mean for how they interact with online training. However, we do think there's some significance in this work. The demand for home care workers is expected to increase due to our ageing population, and it's important to provide benefits and better working conditions and adequate training to improve the quality of care services and to improve job recruitment and retention, which we know are big issues in this industry. And online learning will definitely be a part of this. And it's preferred by some. It reduces travel, it can be done at their own pace. And this, as I said already, was especially important for workers from culturally and linguistically diverse backgrounds. And our findings certainly will inform the development and redesign of our pitch training, and perhaps could help with the design of future dementia education programs targeted to home care workers. So thank you. As you can see, there's a big team working on our pitch project, which is funded by the National Health and Medical Research Council grant. So I'd like to acknowledge all of them, the service providers and healthcare organisations and advocacy bodies that work with us, and of course our family carers and the people living with dementia who have been part of this work. And finally, there's the reference list that I've referred to earlier. Thank you.